pump moving up the arm. Now, if I think that they might have functional lymph nodes, which you would do in the case of, say, primary lymphedema, and by the way, primary lymphedema is usually in the lower extremities, less often in the upper extremities. And I think only once did I see it in the upper extremities. So then this is where I'm going to use the pump. If I'm going to bring it into the axilla, the spiral stroke, you see, and so I'm bringing it right into the axilla. I can tell she's really not enjoying this. And so see how my hand kind of molds to it too? Yeah, good. All right, so you would do that until it's softened. Now we're doing more of, it's really kind of like a spiral stroke, but only going in this direction. So let me just kind of show you. It's like doing this type of a spirograph or a spiral stroke, right? That's still spiral, right? So I would do it holding your arm, and so it's almost a combination of the pump and the spiral.
Almost like an effleurage.
Almost like that. But the thing is, you want it really gentle, which effleurage is gentle. It's really about how you're moving the lymph, the direction that you're moving it to, and where you're sending the fluid to. So I'm going to show you the scoop before I show you the other. There, so that would be the scoop. It's a corkscrew type of a movement. Right? Okay. So the other thing that I was going to show you was how to do it without having to be too aggressive with your hands. And so let's say you're trying to move lymph fluid out of the arm, or maybe you find where there's restrictions in the lymph flow. So if you have that skill base where you can find that, then you would hold that one region where there's restriction, and then come to another region where there's restriction in lymph flow. So for her, it would actually go right here. So then I would just gently hold these in a way of an approximation. So I'm not doing this type of an approximation, I'm doing this type of an approximation. Can you see the difference? Like one's really gentle and one's really firm. Right, so I'm just going to hold it, and that's going to encourage lymph flow in her body. Yeah, and it's already happening. We're already encouraging lymph movement. She's getting really relaxed here. She can hardly keep her eyes open. And you had a question?
Was that the firm approximation?
That was the gentle one that I just did.
One.
Yeah, I mean, you could do it like this, where you're going from the area that's restricted to where lymph is going to move through, because there's a big traffic jam in here, right? You've got the brachial plexus and fat cells, a lot of fat cells right there, right? So we could do it there too. It's okay if you relax and close your eyes if you can't keep them open. All right, so then the next thing is for the hand, and so we're going to do little mini strokes on the dorsum of the hand. And then on the palmar side of the hand. Okay, so we're going to do that until it softens. Everything, the answer to how long do we do it for, the answer is always until it softens. And then we're going to do the reverse milking. So compressing and compressing. You could do it a few times, moving up the digit. And again, compressing from my pinky to my second finger. Yeah. And so then you could finish up with more of the corkscrew type of a movement. It's good, a very good finishing technique, right? And since this lymph movement is going into the neck, you can finish up with just a little bit on the neck. And then make sure you send them home with some good breathing exercises. So I really like the Franklin Method breathing exercises. You can always go on Franklin Method website to get the breathing workshop and do that from home. Watch it from home, okay?
You're gonna see this patient how many times?
So, yeah, the question is how many times for lymphedema? It's supposed to be 5 days a week for, depending on the severity of the lymphedema. So let's just say they have mild lymphedema, then 1 to 2 weeks of 5 days a week. Usually for an upper limb, it's an hour of manual lymph drainage, and then on top of that, the bandaging. So in the beginning, the bandaging could take 30 minutes because the one thing you have to watch out for is that there isn't any numbness or, her fingers don't turn blue. If they do, you have to take it off, and you have to have enough time to account for that. So you could have other patients in the waiting room waiting if you didn't allow enough time. But you cannot send them home with bandages that are too tight. And then, of course, I'll have a home program and, skincare precautions. Let's say in moderate lymphedema, a minimum of 2 weeks, so it could be 2 to 3 weeks, maybe 4 weeks. And then in severe lymphedema, it could be 6 weeks, it could be 10 weeks of daily, 5 days a week, and they're doing it in between. Yeah, it's a lot. It's a very, very intensive program, but it works. All right, so go ahead and break up